Allergy season is in peak season here in Arizona, and I should know personally because I'm having some trouble myself. Here to help us manage our allergies through primary care and to tell us how compound medicine can help is Dr. Pharmacist Stan with Medisol. And of course, we're talking about, the big allergies out here. The trees are blooming. It's getting very much, crazy out there. So, doctor, tell me a little about allergies and how we can pretty much watch some of our symptoms knowing from allergies or a cold.
Well, usually there's maybe a history of allergies. So, most patients will come in and they'll say, well, I've had allergies for, several years, and, this time of year I'm coughing, sneezing, runny nose. So we do a quick eval, making sure it's not cold symptoms, and, if it's more allergy related, we kind of say, well, okay, we can try some over-the-counter treatment options. Just Claritin and Zyrtec are some great over-the-counter medicines that we've used to help treat allergies, moving to nasal sprays, and then sometimes going to prescription medication. Even with sometimes with prescription aid treatment and over-the-counter remedies, sometimes doesn't even combat some of the worst allergies. And then we do offer then some higher level treatment options, but even then sometimes we'll still struggle with allergy control symptoms. Not knowing that sometimes you have one allergy to one item, but you have other allergies to non-environmental allergies like gluten or peanuts, which is commonly found in some over-the-counter remedies.
Yeah.
And that's where Stan can help out and come up with an option to help compound some allergy treatments.
Yeah, you said something very important there, and that is sometimes when they go, oh my goodness, my allergies are getting worse, it might not be the allergies, but it might be what's in the medicine trying to help them fight the allergy.
Correct, yeah. So they often will come and say, well, doc, I'm allergic to Claritin. And I was like, well, are you allergic to the Claritin, or are you allergic to the components in the Claritin, for example?
Yeah.
And it is overseen a lot of times, and we might just label as the individual or patient is allergic to Claritin, try something different.
Yeah.
And then Stan can offer alternative options to compound, to take out the active ingredient and then compound it from that.
Yeah, and Stan, that's why it's so important to really come and see a pharmacist like you that does compound, to sit and talk with them about what they're allergic to, because you do see that all the time, especially with allergies, is that they take the medicine and then it just causes other allergies because there's stuff in it. So how do you help people when it comes to compounding the allergy medicine?
That's right. So we often assume that it's the active ingredient, that is the medication that's causing the issue, without looking at what else is in the tablet itself. We often overlook the fact that about 90% of the medication is a filler, which 40 of them % contain lactose or gluten or corn. And we have people who are allergic to all those ingredients. So instead of switching the medication that could very well be a good fit for you as a patient, let's look at what else is in that pill that could be triggering that allergy. And that's where compounding comes in, because we can compound and take out the allergens and make it pure form without the ingredient that's causing you to have that allergy, so you are able to take the best treatment that's suited for you.
Yeah, and I like that you guys actually have it where Brad's Medicine's here, and you guys have made it compared going to another pharmacist, which is fine, that has Brad's Medicine that is from somewhere else that's for everybody. Yeah. And that's, I think, with compounding, I'm able to get the exact things I need and not all the other stuff.
That's correct, yeah. So we can totally tailor the therapy to Brad based on the prescription that your doctor wants you to have. So sometimes best therapy plans don't work out, not because of the medication, but because of what else is in those medications that could be triggering you to have a reaction, an allergic reaction.
Yeah. So, doctor, just very much finishing up here, the best thing to do is talk with your doctor, see everything you need there, and then also come see the compound pharmacist to make sure you're getting the right allergy medicine.
That's right.
That's it. There you go. I like it.
Right.
Thank you, T, for coming in.
Thank
Appreciate
you.
it, especially this time. I'm going to talk to you because I got some allergies going on. So, all right. You want more information, please head over to the CW7AZ.com's website for everything that Stan can help you with and Dr. Patel's information. So, thank you.
Thank you.
Thank you.
So,